Health Emergencies, a first aid safety meeting video brought to you by weeklysafety.com. Let's begin. Health emergencies can happen without warning. Someone nearby may begin choking, have a seizure, faint, or show signs of a severe allergic reaction. In those moments, quick action can make a real difference. But it is also important to stay calm, check the area for hazards, and only provide the first aid care you are trained to give. Before helping, make sure the scene is safe. Do not rush into an area where you could become injured too. Check the person for life-threatening conditions, call 911 or emergency services when needed, and get consent before providing care when the person is awake and able to respond. If the person is unresponsive, provide appropriate care while emergency help is being contacted. Choking. Choking can become life-threatening very quickly because the person may not be able to breathe, speak, or cough. A person who is choking may hold one or both hands to their throat, which is a common sign that they cannot breathe. Before taking action, ask the person if they are choking. If they can cough forcefully or speak, do not perform abdominal thrusts. Encourage them to keep coughing and stay nearby in case the situation gets worse. If the person cannot cough, speak, or breathe, abdominal thrusts may be needed. Stand behind the person, wrap your arms around their waist, and place the thumb side of your fist just above the navel and below the breastbone. Grasp your fist with your other hand and make quick inward and upward thrusts. Continue until the object comes out or the person loses consciousness. If they lose consciousness, call 911 or emergency services immediately. Seizures. There are different types of seizures, and many only last a few minutes. The best thing you can do is stay with the person, keep the area around them safe, and avoid actions that could cause more harm. If the person falls or begins shaking, ease them to the floor if you can do so safely. Turn them gently onto one side to help keep their airway clear. Move hard or sharp objects away from them, place something soft and flat under their head, and loosen anything around the neck that could make breathing difficult. Do not hold the person down. Do not try to stop their movements. Do not put anything in their mouth. These actions can cause injuries and do not help stop the seizure. Time the seizure if you can. Call 911 or emergency services if the seizure lasts longer than 5 minutes, if the person has trouble breathing or waking afterward, or if another seizure happens soon after the first one. Once they are fully awake, help them sit in a safe place and calmly explain what happened. Fainting. Fainting happens when the brain briefly does not receive enough blood flow. It may be a short and minor event, but it can also be connected to a more serious medical problem. If you feel faint, sit or lie down right away and avoid getting up too quickly. If someone else faints, check that they are breathing and look for signs of injury. If they are not injured and are breathing, position them on their back and raise their legs about 12 inches if it is safe to do so. Loosen tight clothing such as belts, collars, or anything that may restrict breathing. When the person wakes up, help them sit in a safe place. Do not let them stand up too quickly because they may faint again. If the person does not regain consciousness within 1 minute, call 911 or emergency services. If they stop breathing, call emergency services and begin CPR if you are trained to do so. Severe allergic reactions. A severe allergic reaction, also called anaphylaxis, can become life-threatening. It may happen after exposure to certain foods, medications, insect stings, or other allergens. Watch for swelling of the face, lips, eyes, or throat. Trouble breathing, wheezing, hives, itching, pale or flushed skin, dizziness, fainting, nausea, vomiting, diarrhea, or a weak and rapid pulse. These symptoms should be treated as urgent. If someone shows signs of anaphylaxis, do not wait to see if they improve. Call 911 or emergency services immediately. Ask if they have an epinephrine autoinjector. If they do, and they ask for help using it, follow the instructions on the device and provide only the help you are trained or permitted to provide. While waiting for emergency help, have the person lie still on their back if they can do so safely. Loosen tight clothing and keep them covered. Do not give them anything to drink. If they stop breathing, begin CPR if you are trained to do so. Responding safely. During any health emergency, your role is to recognize that something is wrong, get help when needed, and provide safe, appropriate care. Stay calm, communicate clearly, and do not move the person unless they are in danger or movement is needed to provide care. Health emergencies are stressful, but the right response can protect the person in trouble and prevent the situation from getting worse. Know the warning signs, call for help when needed, and never provide care beyond your training. Thank you for watching this safety meeting video. Remember, when someone needs help, calm action matters.